One day in the emergency room.
The patient enters the emergency room, female, Rosa Esquivel, 51 years old, with pictures of fatigue, dyspnea in his daily routine.
Good afternoon, Mr. Rosa. We have reviewed your clinical history. It is correct that you have a diagnostic of aortic insufficiency 5 years ago?
That is right, doctor, but in the layer I had felt very tired and fatigued when doing my normal activity. Even so, I take my medicaments for hypertension, fluid retention, and for coronary artery disease.
At that time, the patient is admitted to hospitalization for the corresponding test to be carried out for an effective diagnostic.
Doctor, we already have the result. Aspiration is diagnosed. Blood pressure 142/50. Echocardiogram where an enlarged left ventricular coverage is seen. Doppler BBS aortic regurgitation to a significant clearance between the valves.
Okay, thank you. This diagnostic is important to perform elective valve replacement surgery. And due to the age our patient is important that prostheses be organic, biological, using traditional thoracotomy technique.
The patient was admitted for surgery and a transesophageal echocardiogram was requested to assist surgery, which revealed a tricuspid aortic valve as the etiology of the aortic regurgitation.
Everything is going great. Time to implant 21 millimeters porcine biological valve prosthesis.
The patient comes out of surgery which keeps her in progressive care of her recovery. In the sixth day,
Good afternoon, Mr. Rosa. We have seen your progress and you are currently asymptomatic. So today we discharge you. Everything went very well.
Thank you very much. I felt very good.